getting better control of diabetes because your food is now touching a different point in the intestine.
Yes.
Earlier it was touching this point,
Mm-hmm.
and now it is touching a point which is 5 feet away from
Way
this.
from there, yes.
And that is more sensitive to sugars.
Yes.
Because earlier this point was not getting a chance to see high levels of sugar.
That's right.
Because by the time your food passes through this length of the intestine, everything would be absorbed.
Yes.
So a point which is about 5 feet away from the original starting point, that has not seen high levels of sugar earlier.
Yes.
And now if we are directly feeding that point, so it thinks that a lot of sugar has come and it sends high amplitude signals to the pancreas, and in return pancreas produces insulin.
Insulin, yes.
So we would say it's like an insulin kick.
Yes.
Whenever you take food, and you can even test, if you take something sweet, rather your sugar levels will go down after 1 hour.
Right.
Because more insulin is released.
Which is a
So
good
I would
thing.
say this is a kind of, you can say, your insulin pump, a natural insulin pump, which is sitting inside.
With is it when your body stops producing insulin, we become diabetic?
This is type 2 diabetes, actually.
Right.
There are two kinds of diabetes. This procedure is not at all useful for type 1 diabetes.
Right.
Because type 1 diabetes means the beta cells in your pancreas, which were supposed to produce insulin, are not doing their work.
Right, okay.
That's type 1.
Okay.
And that happens even in childhood, in small age.
Yes, okay.
And in patients who get diabetes after the age of 25 or 30, generally they have type 2 diabetes. Type 2 means earlier your pancreas was doing well, but now somehow its tissue is okay,
Right.
but it's not producing insulin. Reason is your intestine is not sending signals to the pancreas.
Right.
So intestine has become sluggish, it has become slow, desensitized.
Right.
The first point on the intestine which receives the sugars is now insensitive, and it does not realize that you are taking sugar, so it's not sending proper signals to the pancreas. This is how we can put type 2 diabetes in simple words.
Right.
And now that we have changed that point which receives the food,
Yes.
it's a new point and it's a new sensor.
Yes.
So you can say that you got a new sensor which would send proper signals to the pancreas.
Signals, yes.
Rather, it can even send more than required signal. If you put 2 spoons of sugar in a cup of tea, you might start sweating after 1 hour.
Oh gosh.
That might be too much of insulin for you. This
Yes.
is called as dumping.
Right. Okay.
So,
That's
so
when the
if
word
you ever
dumping.
have that feeling of palpitation, sweating, that means your sugar is actually going low.
Low.
And then you can check what you had 1 hour before that. So
Right.
then you would be easily able to correlate what is hurting you.
Yes.
So this is dumping. The patients who undergo this kind of surgery should always know that you can have dumping with sweets, with a lot of carbohydrates, biscuits, etc. But this dumping is not significant. 98% of the patients won't even get to know what is happening. Only difference would be that with certain foods you will not feel good.
Yes.
If you take 1 cup of ice cream, you might feel comfortable. 2 cups of ice cream might kick you.
Yes.
After 1 hour, you might feel sweating and uncomfortable.
It's too much.
Yeah.
Can she have just for a taste 1 spoon or 2?
No, you can try yourself.
Yeah,
Every
it's a
patient
trial
is
and
different.
error. It's
Only
a
thing is you should know what we have done.
yeah.
You have got a new sensor, which is very new.
Yes. Don't abuse it.
Yes. And it might again get desensitized after some time.
Okay.
Nobody knows that because this is a new surgery.
Yes.
But already we are using this surgery from about last 10 years. And 98% of the patients are doing good.
Excellent.
2% patients again start developing diabetes. Somebody after 7 years, someone after 10 years. And most of them have some weight gain.
So they're not looking after
so
their
what
diet.
I see is, if you don't take care of yourself, keep on taking a lot of sweets, don't do any
Yeah.
exercise, and again start putting up weight, you might have diabetes coming back. So that's why we say do not think that we have eradicated
Yes,
it.
no,
It's
no.
just under control.
Yes.
And the other advantages like the cholesterol, triglycerides, so the end organ damage which this diabetes was doing, that will also be controlled.
Control much
And
better.
we have patients in whom even the kidneys have become better. their
Wow.
creatinine level was going up. It was going like 2.5, 3, which should be actually less than 1.
One, yeah.
So they were kind of, you know, in stage 2 of their kidney disease, which
Oh.
would have pushed them to stage 3 within a couple of years.
Wow.
So they have even come back. But then additional point is your blood pressure.
Mm.
So if you think your diabetes is well under control, you need to keep your blood pressure under control as well
As
if you want to
well.
save your kidneys.
Right. Okay.
It's kind of, you can say it's a very good tool.
Mm.
So not only the diabetes, you should take care of your blood pressure as well. Yes, even a little increase in your diastolic blood pressure can cause a lot of damage to your kidneys.
Ah, right. Okay.
Because your vessels, renal vessels are very much fragile because of diabetes.
Right. So should I
So
continue
you should
to
continue
it's-
with the medication,
Right.
but generally what we see is after 4 or 5 months of this surgery, generally 95% of the patients, they have very much normal blood pressure.
Right.
Rather with tablets, it might start going down. You might
Okay.
start having blackouts.
Yes, I don't want
So
that.
if that
Christ.
happens, you should know that your blood pressure is going low.
Right.
So you should start doing exercise now. You should be walking.
Yes.
After another 3 weeks, you should be doing some exercise in the gym
Yes.
and take the vitamins, which we will prescribe after another week,
Yes.
and good diet, high protein diet.
High protein. Yeah.
HbA1c is one thing which you should always remember, your average blood sugar, the average of last 3 months. That's
Oh.
called as HbA1c.
I'm going to record it all on my mobile
Yes,
phone
Yes.
so that I can send it to
Every
Ms.
3
Gill.
months you should be getting your HbA1c levels.
Right.
Because our target is to keep the HbA1c below 6,
Right. Okay.
right?